Dr. Francisco Cidral is a published researcher in the area of integrated medicine, photobiomodulation, acupuncture, and neurobiology of pain and inflammation, and has a bachelor's in naturology, which is equivalent to naturopathy, specialization in traditional Chinese medicine, such as acupuncture and traditional Chinese massage therapy, master's and PhD in neuroscience, and a postdoctoral fellowship in health sciences. His session will be on the benefits of brainwave entrainment and transcranial photobiomodulation, aka low-level light therapy, for brain health from a scientific and therapeutic perspective. Research has shown great benefits in using these techniques, such as induction and relaxation and decrease in stress, improved brain function and metabolism, as well as optimized neuroplasticity and cerebral blood flow.
First off, thank you very much for the opportunity of talking to such an interesting audience. This is a theme that I have been studying for quite some time. Actually, low-level light therapy started when I was still in naturopathic school. I got hooked and started using it a lot in the clinic. Went into my specialization in traditional Chinese medicine, acupuncture, and there I was introduced to laser acupuncture. So instead of using traditional needles, you can use devices such as this, which is a laser acupuncture device. So you can treat the acupoints with light instead of using a needle. That has a lot of benefits, and it's especially good for those people that don't like needles very much. The benefits are pretty much the same, and it's much easier to use, I would say. Then from there, seeing the results, I got very interested in understanding a little bit more about the mechanisms involved. So I went into a master's and then a PhD in neuroscience, as I ended up specializing in neurobiology of pain and inflammation, always studying the benefits and the effects of low-level light therapy. About a couple years ago, I started using a device called the BrainTap Audiovisual Brain Entrainment device, which is this one over here. I'll talk a little bit about it and explain to you what audiovisual brain entrainment is. And the effects are very good as well. And it's a natural association when we want to decrease stress. If you use natural sources like low-level light therapy and audiovisual brain entrainment. So these are the two things that I'm going to talk to you about today. So before we talk about these therapies, let's talk a little bit about stress and what are some of the stressors that teens face nowadays. Schoolwork, for sure, the grades, worry about the GPA. There's a lot of social issues at school and the pressures that come with it, like bullying, making friends, peer pressure that can lead to stress, and as well as other mental health problems that may occur, such as depression, the problems in the family as well, due to financial security. And so it's been reported that about 80% of teens experience daily stress, and about 34% felt depressed in the last 3 months, and about 13 were actually indeed diagnosed with a mental health condition, and it's all due to stress. And how does stress, or continuous stress, I would say, affect our body? It affects all different systems in your body. It affects your brain, leading to difficulty concentrating, anxiety, depression, irritability, interfering with your mood. It interferes with your cardiovascular system, increasing cholesterol and blood pressure. It can lead to pain and inflammation, or increase pain and inflammation that already exists. It decreases immune function. Imagine this now during the COVID, right? And it interferes with the health of your skin, of your gut, and even with the reproductive system. So influences the whole body. The level of stress since the coronavirus outbreak has only increased. The reports show that about 66.9% of the population report higher stress levels since the beginning of the outbreak. So this is a general problem, and it's happening everywhere in the whole world. So what can we do to manage the stress and anxiety? We can use different types of therapies. We can do physical activity, we can do relaxation exercises, or we can use technology. We can use, for instance, low-level light therapy, such as the helmet that you can see over here, or you can use brainwave entrainment or audiovisual brain entrainment to achieve relaxation. Let's talk a little bit about each one of these two options. Photobiomodulation, which is the new term for low-level light therapy, is the use of red or near-infrared light to stimulate healing, relieve pain, inflammation, and also decrease stress. This is a technology that was developed many years ago. It started in the 50s, actually, with this researcher, Dr. Andrew Masta, and he was working with hair regrowth and wound healing in mice, and then he discovered the benefits of low-level light therapy and laser devices. Nowadays, there is a lot of different sources of this type of therapy, a lot of different products out there in the market. It's either laser therapy or LED, that stands for light emitting diodes. Generally, these are the ones that are more accessible. How does light therapy work? It's quite complex, but trying to simplify it works at a cellular level. Like depending on the specifics of the wavelength or the type of light that you're using, it's going to enter the cell and it's going to go into the mitochondria. There is a specific particle there that absorbs light that's called the cytochrome C oxidase, and that increases its activity. When this activity is increased, as a result, you have the more production of ATP, which is the cellular energy, and there is an overall impact and release in nitric oxide, which is a vasodilator, and increases circulation, decreases inflammation, and enhances the transport of oxygen and immune cells throughout the tissues of your body. The clinical effects of low-level light therapy is an increase in oxygenation in your blood. There is an increase in collagen production. There is an overall effect on muscle regeneration. If you had an accident or if you have an inflammation, it decreases. There is also an effect in the nerve or in the nervous system, and also even in bone formation. How about the effects on the brain? There is a lot of different good points, like it increases metabolism, helps with the blood flow and the circulation in your brain, and which is, by the way, what brings oxygen and energy to your brain. It increases neuroprotection, decreases the effects of oxidative stress, reduces inflammation, increases and stimulates the formation of new neurons and also new connections in between the existing neurons. So I'm going to look at each one of these briefly. So in the metabolism, increased intracellular ATP production is one of the most strongly supported mechanisms of action, which means it gives your brain more energy because it boosts the production of energy inside of the mitochondria. The blood flow is something that can be easily measured, and we have done that in the study that you can see over here, the effect of transcranial LED therapy on cerebral blood flow. This was a study that was conducted by our group showing that low-level light therapy through LEDs increases blood circulation in your brain. Another benefit is decrease in oxidative stress. So oxidative stress is something that occurs when there is an imbalance between the production of reactive oxygen species and the ability of the body to counteract these effects. As you can see here in these apples, they are a demonstration of what happens over time when oxidative stress breaks down our cells, causing aging and disease. A decrease in inflammation is another great benefit of low-level light therapy. Neuroprotection, as I told you before, is the effect on protecting the cells from damage and promoting survival and longevity. Another great benefit, synaptogenesis, which is low-level light therapy stimulates new communications in between the neurons. So this process is very important for many brain conditions, including normal function, of course, but also after traumatic brain injury or stroke. This is very important. And here is neurogenesis, which is the effect of low-level light therapy on differentiation of stem cells into functional mature neurons. So this is the creation or the formation of new brain cells. And this is the one example of a transcranial photobiomodulation helmet, or a helmet, low-level light therapy helmet to be used on your brain. It's a very simple application. The LEDs irradiate directly to the skull, through the hair, and with optimum therapeutic outcomes. And it's a simple session. You could do that like 2 or 3 times a week for 10 minutes, and you already see the benefits. So next, I'm going to talk a little bit about brainwave entrainment. And I'll tell you what brain waves are, what they represent, how to modulate them with external stimulation, what are the main benefits, and then talk a little bit about the device that I showed you before. So brain waves can be measured through EEG and are rhythmic and repetitive patterns of neuronal activity in the central nervous system. So in healthy individuals, specific brainwave patterns are associated with various different mental states. As you can see over here, we're generally in beta, like during the day-to-day activities, or when you're concentrating or when you're learning. That's the rhythm of your brainwaves, and it's called beta. People get more into alpha when they start relaxing, and this is very common when you're doing yoga or doing meditation. You can see more alpha activity. Theta and delta have an association with the sleep states, and gamma is something that was first discovered in monks in Nepal meditating, and it has to do with insight, with expanded conscious. And it's pretty simple. If you want to actually modulate your brain waves, we use a principle of physics called entrainment, which is a process by which two interacting systems assume the same vibration or the same period. That's why you call it. And here you can see an example of brainwave entrainment occurring in a population. Up top in A, you see the entraining stimulus. In this case, was auditory, so a sound, repetitive sound like this, at a specific rhythm, and then all the neurons start to work in that same rhythm. So you have an entrainment phase, and then afterwards, when you stop this external stimulation, then they resume their normal activity. So there are different types of entrainment. Auditory brainwave entrainment uses audio, and we can use different techniques such as isochronic tones, which are repetitive beats, such as this. You can use binaural beats, which are 2 different beats. Like in the example, you could see a sound wave in 440 hertz and another one in 430. And your brain does not understand the differences, so it creates a new one at about 10 hertz, which represents alpha. So you're training your brain into alpha. Apart from audio, there is also visual brainwave entrainment. In this case, of course, you are using flashing or pulsing lights through specially designed glasses, such as the device that I showed you before. What are the benefits of brainwave entrainment? You have a balanced brainwave state, you have reduced stress, you achieve better sleep because you can expose the brain to theta and delta, and then the brain relaxes and the person relaxes when they're sleeping. Also, you can increase mental capacity or mental acuity depending on the specifics of the brain waves that you induce. If you want to induce more relaxation, then you induce alpha. If you want to improve sleep, then you use theta and delta. And if you want the person to be more creative, more imaginative, then you can induce gamma. This technique has been used for many years as well. And this actually picture here shows you the first light and sound device that was clinically used in 1958. It was called the Brainwave Synchronizer. Nowadays, we have much more portable devices such as the BrainTap headset, and that has, includes the guided visualization with holographic music, then the audio brain entrainment, isochronic tones, binaural beats, and also visual stimulation. A lot of different sessions for specific needs. And I'm going to show you a couple of results that we got from some of the studies that were conducted. This was a pilot study looking at the effects of brainwave entrainment with this headset on mood and quality of sleep of university students. And you can see that there was a reduction in perceived stress scale and also a smaller number in the Pittsburgh Quality of Sleep Index. Before, they were around 7 in the overall score, which means poor quality of sleep. And then after 6 weeks of using audiovisual brain entrainment, it went down to 3.8 or 3.9, which means good quality of sleep. There was also an increase in heart rate variability that is associated with a more relaxed state, especially when you have an increase in parasympathetic activity. And there was a reduction in the overall stress index and a reduction in heart rate, demonstrating that these people were more relaxed. Nowadays, we're conducting a lot of continued research. One of them is with the Seminole State College of Florida, and we're looking at the effect of brainwave entrainment and transcranial photobiomodulation on physical measures of college athletes, like the female golf team of the school. We're looking at quality of sleep, mood, anxiety and stress, brain health, and also the effects upon the autonomic nervous system through heart rate variability. There is a picture of some of the sessions. On the left, you see Dr. Geraldine holding the low-level light therapy transcranial photobiomodulation device. So I hope you have enjoyed this presentation. If you want to reach out, here is my email. And we also offer a couple of free courses on audiovisual brain entrainment and transcranial photobiomodulation at our school website that we're just starting in the US called Integrative Health School. Please join us there. If you have any questions, don't hesitate to reach out to me. Thank you very much again.